The internet right now is sort of obsessed with anti-inflammatory diets. Um, Turmeric lattes, celery juice. So do these diets actually help? And what kind of food should we avoid for patients with rheumatoid arthritis?
Yes, that's not a myth. Food
Not
does matter. It's very important. Anti-inflammatory diet is very important in the management of gout and rheumatoid arthritis.
Mhm.
It's it not. It's very important to understand that if someone already developed rheumatoid arthritis, just eating healthy food and eating anti-inflammatory diet, that's not enough. At that stage, when they already have the disease, that's not enough. It cannot replace medication, but it can improve the symptoms and try to control flare-ups. There are some studies actually suggest that patients who followed anti-inflammatory diet, it can actually prevent the development of rheumatoid
Mm.
arthritis. But what is anti-inflammatory diet? It's very closely related to Mediterranean diet. It's a whole food.
Okay.
It needs to include healthy fats and rich in omega-3 fatty acids. It's certain fish, salmon, mackerel, that's rich in those plant-based omega-3 fatty acids. That could be chia seeds, walnuts, um, extra virgin olive oil is also rich in healthy fats. Others antioxidant foods are included in this diet. Those are food they are rich in antioxidants, mostly berries, colorful vegetables, and your green leafy vegetables, kale, spinach. They're anti-inflammatory. They can have anti-inflammatory properties. Another is the whole grapes like
Yeah.
quinoa. Those are very important too. And as you mentioned, some spices like turmeric, it does have
Mhm.
an anti-inflammatory. Like ginger, it does have anti-inflammatory
Um,
properties. Yes, that's not a myth. They actually can make difference. They cannot cure the disease. They cannot stop you from taking medication. Usually, they
yeah.
wouldn't, but they play important role. There are certain foods that definitely have pro-inflammatory properties, like red meat, like sugars,
Mhm.
any refined sugar, it is pro-inflammatory. Any ultra-processed food, frozen food, and a fast food, and certain type of red meat as well. And there are some individuals, after some times of living with the disease, people kind of determine for themselves a certain type of food. It does cause them flare up. It's not universal for them. That is like gluten. Gluten doesn't cause flare up for everyone, but some people feel and they're right because it's their body. Maybe
Mhm.
gluten is one that, because it's not that close. There are a lot of studies going about ongoing that, but yes, some people can have individual like I hear it a lot. Certain nightshade vegetables, patients say if we eat, next day we have a flare up. And it's true for them. It's not a myth. For their
Oh.
body, we might not know the mechanism yet, but for their body, that's how that's. But they're the ones that I mentioned that we universally we know that they have pro-inflammatory and anti-inflammatory properties. That does matter.
Not one magic food, but a balanced approach.